Hi, I'm going to start my video by doing hand hygiene. I'm going to use the alcohol rub for the hand hygiene. My patient isn't in any kind of isolation, so I don't require any kind of PPE right now. So before starting, I'm just going to quickly check my patient's identity so that he's the correct person I'm dealing with. Can you please state your name and date of birth? His name is Mr. Beeb and his date of birth is 1997, November 2nd. Perfect. Now I'm going to quickly provide privacy for my patient, closing the curtains. I'm going to explain the procedure to my patient. Hi, my name is Lisa Chaudhary. I'm student nurse of Seneca College. I'm going to clean your wound today. On that process, I'm going to remove your disc dressing and provide you the new dressings so that you're clean and comfortable. Is that okay? He says it's fine. Okay, perfect. Now is there any kind of allergies or sensitivities that you want me to know? He says no. Perfect. And do you have any kind of pain or discomfort you're feeling right now? He says no. Perfect. Now, do you want to use any kind of facilities before starting? He says no. Okay, and so I'm just going to give you a little knowledge about what I'm going to do today so that you're aware of everything I'm doing. Okay, and so I'm going to clean your wound today so that you don't have any kind of infection. Dirty wounds leads to infection and it delays the process of healing, and I don't want you to have delayed wound healing. So I'm going to start your cleaning. Is that okay? He says okay. Perfect. So before starting, I'm just going to raise the bed to my appropriate height level, safe working height level. Okay, raising the bed to my waistline. Perfect. And now I'm just going to quickly assess the surrounding around the wound. Okay, the skin temperature feels perfect. There isn't any sign of skin breakdown or skin drainage. Perfect. So Mr. Beef, would you like me to call second nurse so that she would help you with this positioning? He says no. And are you feeling restlessness right now? He says no. Perfect. So now I'm going to place a disposal bag between sterile field and Mr. Beep. Yeah. Okay, and I'm going to put on the clean gloves right now. Okay, now I'm going to slowly remove the dressing from my patient. Remove the tape layers by layers slowly. Okay, perfect. My patient has little drainage on his wound. The drainage is kind of pale, watery, and has reddish color. So it is kind of serosanguinous drainage. And the skin around the wound is kind of reddish and it doesn't have any signs of infection. There is no kind of pus or any discharge, yellowish discharge seen. So perfect. So I'm just going to throw these clean gloves. Okay, I'm going to do the hand hygiene. Perfect. I'm going to place this underneath my patient so that there isn't any kind of mess while cleaning. Perfect. Now I'm going to prep my sterile field real quick. Okay. Placing these here. Taking the stuffs that I need for the dressing. Okay. Just going to take more surgical pad just in case. Perfect. I'm going to discard this in disposal bag. Now I'm going to wear the sterile gloves. I don't have oh sorry, before wearing the sterile gloves, I'm just going to pour the NS solution inside the yeah, for the cleaning. And before that, I'm going to check this expiry date. Okay, pouring the NS solution, and now I'm going to wear the sterile gloves. So I don't have the sterile gloves with me. I'm going to use these gloves as the sterile gloves. I'm going to turn it as a sterile technique. Perfect. Okay, now I'm going to use these forceps for the cleaning. Okay, I'm going to clean from least contaminated to most contaminated. One swipe. Okay. Again, doing from least contaminated to most contaminated. One swipe. Perfect. I'm going to clean the wound until and unless it's cleaned. Again, one swipe. Okay, now I'm going to pat dry. One try, and yeah, perfect. My wound is dried now. I'm going to place the appropriate dressing pad on top of the wound. Perfect. Okay, now I'm going to secure my wound with the tape. Perfect. 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 So my wound is properly secured and it's tight. Now I'm going to throw my sterile gloves, do the hand hygiene. Okay, and remove all these. Remove all this, do hand hygiene. I'm just going to use this as blanket now. I'm covering my patient, ensuring he's comfortable. Are you comfortable right now? He's okay. And now I'm going to document if I've seen any kind of abnormalities. That is, I've seen none, just a little bit drainage, that is serous drainage. I'm going to yeah, that's all for today. Thank you.